Tiers are an important aspect of pharmacy insurance, so we'll discuss them a little further here. As we saw earlier, a tier is a list of drugs that will be a specific cost to the patient. The copay that the patient pays at the pharmacy will depend on which tier the drug falls under. The cheaper medications are listed as Tier 1. Moving up to Tier 2, the patient will pay a higher copay for drugs on this tier since they are usually more costly overall. This pattern continues for successive tiers, whether it be Tier 3, 4, or even higher. Here is an example of the tier system for Medicare. As you can see, Tier 1 drugs are most of the generic medications. If a medication is preferred first choice for treatment, but does not have a generic form available, it would fall under Tier 2, which is a slightly higher copay. Brand name drugs, which are not the preferred first-line choice, are Tier 3 and so on. There are several ways the PBMs can work to help minimize costs to patients, and here are some of the more common methods. Putting medications into tiers helps to ensure that more cost-effective options are chosen first, and if a more expensive choice must be taken, then the majority of the cost of the medication will still be paid for. Drug utilization reviews, or DURs, help ensure that the drug chosen is appropriate, timely, and is also another way of choosing the best cost-effective drug. We'll discuss DURs more in a bit. Choosing the generic alternative, if available, will always be cheaper than a brand name medication. Utilizing mail order services allows patients to get a bigger day's supply of the medication for a cheaper amount. Offering disease state management services allows patients an opportunity to learn more about how they can best manage their situation and best avoid costly side effects of either medication therapies or the disease itself. Drug utilization reviews, or DURs, are put in place to help make sure that the patient safety and compliance is maximized. As I said earlier, performing a DUR helps ensure that patients are taking drugs on the PBM's formulary, that the chosen medication is the most cost-effective option, that more expensive alternative therapies are saved as a second or third choice, and also that the patient is complying with current therapy. One important tool in the DUR process is the prior authorization, or PA. Drugs often require a prior authorization if they are not the preferred first choice for therapy. When working in the pharmacy and you experience a prior auth reject when trying to process a claim, you should always notify the patient of the issue and then the doctor's office. The doctor's office will need to either change to an alternative medicine or call the insurance phone number listed on the reject and attempt to get the prescribed drug paid for. PAs can rarely be taken care of the same day, but more commonly will take a few days at a minimum.